This is a presentation on Medicare coverage, Part B, for preventive services and federally qualified health centers. My name is Kim Laloma. Federally qualified health center services and Medicare coverage, Part B. FQHCs deliver many outpatient primary care and preventive health services. There is no deductible and patients usually pay 20% of charges or the Medicare amount approved. Patients pay nothing for preventive services, and all FQHCs offer discounts if a person has limited income. Preventive Services, Medicare Part B. During the first year that a patient has Part B, he or she may get a Welcome to Medicare preventive visit. The visit includes a review of medical and social history related to his or her health. It includes education and counseling about preventive services, and when a patient makes an appointment, he or she should schedule a Welcome to Medicare preventive visit, which the patient pays nothing for if the doctor accepts assignment. If a patient has a current prescription for opioids, the provider will review potential risk factors for opioid use disorder, evaluating severity of pain, as well as current treatment plans. The provider may also provide information on non-opioid treatment solutions or refer the patient to a specialist, if appropriate. The provider will review a patient's potential risk factor for substance use disorder and refer for treatment if needed. If additional tests or services are performed during the same visit that Medicare doesn't cover under this preventive benefit, a patient may have to pay coinsurance, and the Part B deductible may also apply. If Medicare doesn't cover the additional tests or services, such as a routine physical exam, a patient may have to pay the full amount. Preventive Services, Medicare Part B. If a patient has Part B for more than 12 months, he or she may obtain a yearly wellness visit to develop or update a personalized plan to prevent disease or disability based on current health and risk factors. This is not a physical exam, and Medicare covers this visit once every 12 months. A provider will ask the patient to fill out a health risk assessment as part of this visit. Additionally, a provider will perform a cognitive assessment to look for signs of dementia, including Alzheimer's disease. Medicare covers a separate visit to do a more in-depth review of cognitive functions to check for conditions such as dementia, depression, delirium, or anxiety. A patient pays nothing for a yearly wellness visit if the doctor accepts assignment. If the doctor performs additional tests during the same visit that Medicare doesn't cover, a patient may have to pay a coinsurance, and the Part B deductible may apply. If Medicare doesn't cover the additional tests or services, such as a routine physical exam, a patient may have to pay the full amount. Preventive Services, Medicare Part B, abdominal aortic aneurysm screening and alcohol misuse counseling and screening. If you are at risk with a family history, a man 65 to 75, or you have smoked at least 100 cigarettes in your lifetime, Medicare covers abdominal aortic aneurysm screening ultrasound. The patient pays nothing for the screening if a qualified healthcare practitioner or doctor accepts assignment. Medicare covers alcohol misuse screening if you're an adult, including pregnant women who use alcohol but don't meet the standards for alcohol dependency. If the primary care practitioner or doctor decides the patient is misusing alcohol, the patient may get up to 4 face-to-face counseling sessions per year. The patient must get counseling at a doctor's office, primary care setting, and he or she will pay nothing if the primary care practitioner or doctor accepts assignment. Preventive Services, Medicare Part B, bone mass measurements and cardiovascular behavioral therapy. Medicare covers bone mass measurements once every 24 months for people who have certain conditions or meet criteria, and this test helps to see if a patient has broken bones. A patient pays nothing for this test if a qualified health provider or doctor accepts assignment. Medicare includes a cardiovascular behavioral therapy visit one time each year with a primary doctor or qualified primary care practitioner in a primary care setting to help lower risks of cardiovascular disease. During this visit, the doctor may give tips on eating well, discuss aspirin use, or check blood pressure, and the patient pays nothing if the doctor accepts assignment. Preventive Services, Medicare Part B, cardiovascular disease screenings, and cervical and vaginal cancer screenings. Medicare covers cardiovascular disease screenings, blood tests for cholesterol, lipid, and triglyceride levels that help detect conditions that may lead to a heart attack once every 5 years, and the patient pays nothing for tests if the qualified health provider or doctor accepts assignment. Medicare includes a Pap test or pelvic exam to check for cervical and vaginal cancers. As part of the pelvic exam, Medicare covers clinical breast exams to check for breast cancer, and these tests are covered once every 24 months or once every 12 months if a person is at high risk for vaginal cervical cancer or if the person is of childbearing age and had an abnormal Pap test in the past 36 months. Medicare covers HPV tests once every 5 years if the person is 30 to 65 without HPV symptoms as part of the Pap test. The patient pays nothing for the lab Pap test, the Pap test with lab HPV, the Pap test specimen collections, and the breast and pelvic exams if the doctor accepts assignment. Preventive Services, Medicare Part B, colorectal cancer screenings. Medicare covers colorectal cancer screenings to find precancerous growths or cancer early, and Medicare may cover one or more of these screening tests. Barium enema. Medicare covers this test once every 48 months or 24 months if the person is at high risk and 50 or older. A patient pays 20% of the Medicare approved amount for their doctor's services. The Part B deductible doesn't apply, and in a hospital outpatient setting, the patient pays the hospital copayment. Colonoscopies. Medicare covers this test once every 120 months, once every 24 months for high risk, or once every 48 months after a previous flexible sigmoidoscopy. The patient pays nothing for the test if the doctor accepts assignment and there is no minimum age requirement. If the doctor finds and takes out a polyp during the colonoscopy, the patient pays 20% of the Medicare approved amount for doctor services as well as copayment in a hospital outpatient setting, and the Part B deductible doesn't apply. Fecal occult blood tests. Medicare covers this test once every 12 months if a person is 50 or older. The patient pays nothing for tests if the qualified health provider accepts assignment. Flexible sigmoidoscopies. Medicare covers this test once every 48 months if a person is 50 or older, or 120 months after a previous screening colonoscopy if a person is not at high risk. The patient pays nothing for the test if the qualified health provider accepts assignment. Preventive Services, Medicare Part B, counseling for tobacco use, tobacco-caused disease, and depression. Medicare covers up to 8 face-to-face visits in a 12-month period if you use tobacco, and a patient pays nothing for the counseling session if the doctor accepts payment. Medicare covers one depression screening per year. The screening must be completed in a primary care setting, like a doctor's office, that can provide follow-up treatments or referrals. The patient pays nothing for the test if the doctor accepts assignment. Preventive Services, Medicare Part B, diabetes screening and self-management training. Medicare covers up to 2 glucose lab test screenings each year if the healthcare provider determines the person is at risk for developing diabetes. A person pays nothing if his or her doctor accepts assignment. Medicare covers diabetes outpatient self-management training to instruct a person on how to cope with, as well as manage a person's diabetes. The patient must have been diagnosed with diabetes and have a written order from their doctor, and some patients may also be eligible for medical nutrition therapy training. The patient pays 20% of the Medicare approved amount, and the Part B deductibles applies. Preventive Services, Medicare Part B, flu shots and foot care. Medicare includes a vaccine or flu shot per flu season, and a patient pays nothing for this dose if the qualified healthcare provider or doctor accepts assignment for giving the shot. Medicare covers yearly foot exams or treatment if a patient has diabetes-related lower leg nerve damage that can upsurge the risk of medically necessary treatment or diseases or foot injuries, such as heel spurs, bunion deformities, hammer toe, or even more serious conditions such as the increased risk of limb loss. Patients pay 20% of the Medicare-approved amount of medically necessary treatment of what his or her doctor approves. Additionally, Part B deductibles apply, and also patients pay a co-payment for medically necessary treatment in a hospital outpatient setting. Preventive Services, Medicare Part B, glaucoma tests, hearing, and balance exams. Medicare covers glaucoma tests once every 12 months if the patient is at high risk for the specific disease. People who are at high risk include Hispanics over 65, African Americans over 50, and those who have diabetes or a family history of glaucoma. An eye doctor who is legally allowed in your state must do or supervise this screening. The patient pays 20% of the Medicare approved amount. The Part B deductible applies, and the patient also pays a co-payment in a hospital outpatient setting. Medicare pays for hearing and balance exams if a healthcare provider or your doctor orders them to see if you need medical treatment. The patient pays 20% of the Medicare approved amount. The Part B deductible applies, and the patient also pays a co-payment in a hospital outpatient setting. Preventive Services, Medicare Part B, hepatitis B shots, virus infection screening. Medicare covers vaccines or shots if a patient is at high or medium risk for hepatitis B. Risk factors include hemophilia, living with someone who has hepatitis B, end-stage renal disease, or ESRD, or diabetes. A patient pays nothing for the shot if the qualified health provider or doctor accepts assignment. Medicare covers this screening yearly only if a patient is at continued high risk and does not get a hepatitis B shot. Additionally, it is included if your primary care doctor orders it. The patient pays nothing for the screening test if the doctor or other qualified healthcare provider accepts assignment. Medicare features this screening if you meet one of the following conditions. You are at high risk for a hepatitis B virus infection, or if you are pregnant. If you are pregnant, it's covered. At the first prenatal visit for each pregnancy, at the delivery time for those with continued or new risk factors, at the first prenatal visit for future pregnancies, even if you have previously received the hepatitis B shot or had a negative hepatitis B virus screening result. Preventive Services, Medicare Part B, hepatitis C and HIV screenings. Medicare will only cover a hepatitis C screening test if the healthcare provider orders one, and the patient pays nothing for the screening test if the qualified healthcare provider or primary care doctor accepts assignment. Medicare covers yearly repeat screenings if a person is at high risk. To obtain hepatitis C screenings, a person must meet one of these conditions: born between 1945 to 1965, had a blood transfusion before 1992, is at high risk because of illicit drug use, which were injected. Illicit drugs used, which were injected. Medicare covers HIV screenings up to 3 times during a pregnancy. The patient pays nothing for HIV screenings if a qualified healthcare provider or doctor accepts assignment. Medicare provides HIV screening once every 12 months if the person is younger than 15 years or older than 65 with an escalated risk, and if the person is between the ages 15 and 65. Preventive Services. Medicare Part B, lung cancer screenings and mammograms. Medicare covers lung cancer screenings with low-dose computed tomography once per year if these conditions are met. The patient is 55 to 77. The patient is asymptomatic with no signs or symptoms of lung cancer. The patient quit smoking within the last 15 years or is a current smoker. The patient averaged one pack a day for 30 years. The patient obtains a written order from his or her doctor. Prior to the first lung cancer screening, the patient needs to schedule an appointment with his or her doctor to discuss the benefits and risks of lung cancer screening. The patient and doctor can decide on what lung cancer screening is appropriate for him or her. Medicare covers a mammogram screening to check for breast cancer once every 12 months for women 40 and over. Medicare covers one baseline mammogram for a woman between 35 to 39. A patient pays nothing for the test if the doctor or other qualified healthcare provider accepts assignment. Part B covers diagnostic mammograms more frequently than once a year when medically necessary. The patient pays 20% of the Medicare-approved amount for diagnostic mammograms. The Part B deductible applies. Preventive Services. Medicare Part B, Medicare Diabetes Prevention Program. Medicare covers a once-in-a-lifetime health behavior change program to help prevent type 2 diabetes, and a patient pays nothing for these services if eligible. The program begins with weekly course sessions offered in a group setting over a half-a-year time frame. In these sessions, a person gets training to make a lasting, realistic behavior alteration concerning nutrition and exercise, advice on how to get more exercise, techniques for controlling weight, a trained coach who deals with motivation, support from people who are enduring similar challenges and goals. Once a person completes these sessions, a person gets 6 monthly follow-up sessions that helps a person preserve healthy habits, 12 added months of ongoing maintenance sessions for persons who meet certain weight reduction and attendance goals. To be eligible, the patient must have all these conditions. The patient has Part B Medicare. A patient has hemoglobin A1C tests results between 5.7 and 6.4%, a fasting plasma glucose of 110 to 125 milligrams per dl on a 2-hour plasma glucose of 140 to 199 milligrams per dl, oral glucose tolerant tests with a year prior to attending the first course session. A patient has a body mass index BMI of 25 or more, a BMI of 23 or more if a patient is Asian. A patient has never been diagnosed with type 1 or type 2 diabetes or end-stage renal disease, ESRD. A patient has never participated in the Medicare Diabetes Prevention Program. Preventive Services, Medicare Part B, Nutrition Therapy Services, and Obesity Behavioral Therapy. Medicare may cover medical nutrition therapy services and certain similar services if a patient has diabetes or kidney disease or a kidney transplant in the last 36 months and the person's doctor has referred him or her for services. A nutrition professional or registered dietitian who meets certain requirements can provide medical nutrition services. If a person has diabetes, he or she may be eligible for diabetes self-management training. A patient pays nothing for these services because the coinsurance and deductible do not apply. If a patient has a body mass index of 30 or more, Medicare covers obesity screenings and behavioral counseling to help the person reduce their weight by concentrating on exercise and diet. Medicare covers counseling if the primary care doctor or other qualified provider offers the session in a primary care setting where a personalized prevention plan can be created, incorporating other care. The patient pays nothing for the service if the doctor accepts assignment. Preventive Services, Medicare Part B, pneumococcal shots and prostate cancer screenings. Medicare covers pneumococcal shots or vaccines to help stop pneumococcal infections, including various types of pneumonia. The two-shot guard against different strains of the bacteria. Medicare covers the first shots at any time and covers a different second shot if it's given 1 year or later after the first shot. The patient should discuss his or her doctor if 1 or 2 shots are needed, and he or she pays nothing if the doctor accepts assignment for giving these shots. Medicare covers digital rectal exams and prostate-specific antigen (PSA) tests once every 12 months for men over 50. It starts the day after the patient's 50th birthday. For a digital rectal exam, a patient pays 20% of the Medicare-approved amount, and Part B deductible applies. A patient must also pay a copayment in a hospital outpatient setting, and the patient pays nothing for the PSA test. Preventive Services, Medicare Part B, sexually transmitted infections, STI screenings and counseling. Medicare covers STI screenings for chlamydia, gonorrhea, syphilis, and or hepatitis B. Additionally, these screenings are covered if the patient is pregnant or at increased risk for an STI when the primary care provider orders the test. Medicare covers these tests once every 12 months or during certain times for a pregnancy. Medicare includes up to 2 individual 20 to 30-minute face-to-face high-intensity behavioral counseling sessions each year if a person is a sexually active adult with an escalated risk for an STI. Medicare only covers these counseling sessions with a primary care doctor at a primary care setting, and Medicare will not cover counseling as a preventive service in an inpatient setting like a skilled nursing facility. A patient pays nothing for these services if the primary care doctor accepts assignment. What is not covered by Medicare Part A or Part B? Medicare does not cover everything. If you need specific services that Part A or Part B does not cover, a patient must pay for them out of pocket unless they have other coverage, including Medicaid, to cover the costs, or if they're in a Medicare Advantage plan or Medicare cost plan that covers these services. Medicare cost plans and Medicare Advantage plans may cover extra benefits such as fitness programs or dental, hearing, and vision services. Items or services that original Medicare does not cover include most dental care, eye exams for prescription glasses, long-term care, hearing aids and exams for fitting them, routine physical exams, massage therapy, cosmetic surgery, dentures, concierge care, also known as concierge medicine, retainer-based medicine, boutique medicine, platinum practice, or direct care. Covered items or services you get from an opt-out doctor or another provider, except in the case of an emergency or urgent need.